Good morning, good afternoon, good evening. Thank you so much for joining this virtual dialogue, Navigating Gavi, supporting civil society organisations in advancing access to HPV vaccination. And we're delighted to be hosting this in partnership with Gavi. So I'm Kirsty Graham. I'm the Director of Capacity Building at the Union for International Cancer Control. And for those of you not familiar with UICC, we're the oldest and largest global membership organisation dedicated to taking action on cancer. Our mission is to unite and support the cancer community to reduce the global cancer burden, promote greater equity, and ensure that cancer control remains a priority in the global health and development agenda. And addressing the burden of women's cancers is a key priority area of work for UICC. Now, this virtual dialogue is intended to be an information session for civil society organisations on Gavi, as you'll have seen when you registered. We'll be talking a little bit about its operating model, its commitment to HPV vaccination, and how civil society organisations can be engaged and supported through its work to support the introduction and scale-up of HPV vaccination. And just very briefly, to give you a little bit of background behind why we put together this virtual dialogue, it really has been developed in response to requests from UICC member organisations and in response to the findings of a landscaping study that we conducted in 2023, which explored the role and engagement of civil society organisations, particularly UICC members, in the introduction and scale-up of HPV vaccination. So this study included a literature review, a survey, key informant interviews, and really highlighted the critical role that civil society organisations play in advancing access, particularly in three areas: advocacy, awareness raising, and community mobilisation. And in some cases, civil society organisations were also directly responsible for delivery of the vaccine. Now, whilst there was such substantial diversity in the people who were involved in the survey and in terms of cancer civil society organisations, the report highlighted several key challenges and needs of civil society organisations that really need to be addressed in order to enable them to optimally support HPV vaccination introduction and scale-up. So these needs included, amongst others, grants, technical assistance, knowledge for advocacy, and specific reference to the need for increased awareness of global opportunities, including the work of Gavi. And that's why we're here today. So I don't want to talk for too long. I really want to give as much space as possible to the topic we'll be covering today. So we're going to begin with a few short presentations from Gavi colleagues who are joining us, and followed by a panel conversation bringing country perspectives from both Nigeria and Pakistan. I really welcome you to use the functionalities of the Zoom platform, so please open the chat box, introduce yourself, and post any questions and comments there during the dialogue. We'll be attempting to respond to those during the discussion, but also we'll be having a Q&A session at the end of the presentations and the panel. So with that, I'd like to hand over to Emily Kobayashi, who is the head of HPV vaccines programs at Gavi, the Vaccine Alliance. She's spearheading Gavi's initiative to reach 86 million girls with the HPV vaccine by the end of 2025. She provides technical guidance and oversight for HPV vaccine implementation programs across Gavi-eligible countries. She's going to talk to us today about Gavi's efforts in HPV vaccination, its commitment, and its HPV revitalization program. So Emily, I'll hand over to you.
Thank you very much, Kirsty, and it's an honor to be among the civil society representatives who are really the people that make our programs possible, because civil society knows how to talk to communities, knows how to explain the vaccine in the language and in the terms that people can understand so that they can make the decision to take up the vaccine. So it's really an honor to be here today. And I think my piece of the discussion is just to provide the context of what is happening globally with HPV vaccine uptake and what is Gavi's role in that. And after my presentation, I want to leave you with three key messages. First, I want you to know and embrace and appreciate that you are part of a significant scale up in access to HPV vaccine around the world. And to understand that at the time of HPV vaccine introduction, there's a surge of resources, attention, and communication around cervical cancer that presents a unique opportunity for reaching out to communities, not just about vaccines, but also about other cervical cancer prevention and treatment interventions. And thirdly, to realize that as we look ahead, in order to continue to expand the reach of the vaccine, we need to focus on how health systems deliver the vaccines to eligible girls over time. So let me just start. If you're a cancer CSO that hasn't worked as much in the vaccination space, you may not know who Gavi is. So Gavi, the Vaccine Alliance, is a public-private partnership that helps to vaccinate more than half of the world's children. And so we work with country governments in target countries, as well as with other members of the alliance, including UNICEF, World Health Organization, donor country governments, and the private sector, to assist countries with long-term funding, pooling demand for vaccines, accelerating access to vaccines, and overall just strengthening the systems that are there to deliver vaccines in the community. So in 2023, there was a unique opportunity for HPV vaccination where we were coming out of the COVID days when schools had closed and it had been hard to reach our target populations of girls. And we also were starting to see from the manufacturers of these vaccines much more availability. And so the Gavi board made a decision to revamp and revitalize the HPV vaccination program to increase access to the HPV vaccine. And so what this meant was that Gavi was investing in enabling new countries to introduce the HPV vaccine who had never had it before, and also for countries to conduct these multi-age cohort campaigns that are reaching girls in the window of 9 to 14. Gavi also made new investments and new partnerships to facilitate improvement of coverage of the vaccine in countries that had already introduced it and may have been struggling, especially during the COVID time. And then lastly was thinking about how do we and investing in strengthening the service delivery platforms for adolescents and using the HPV vaccine as a way to do that. And so when we took on this initiative and made this commitment, we set a goal to fully immunize at least 86 million girls by 2025. So I want to show you where we were when we made that commitment. So at that point, and this is looking just at countries that are eligible for Gavi's core support, we had supported 32 countries by the end of 2022 to introduce the vaccine, and you can see them there. And if we look to the end of last year, at the end of 2024, we'd added an additional 9 countries, and you can see them. And some of these were very large, and they include Nigeria. I know we'll hear more about their experience today. Indonesia, Bangladesh. These were very significant numbers of girls that we were able to reach in those countries. But when we look ahead to the end of this year, we'll be up to 53 countries that will have been supported and continuing to fill in the map. And if I had one more click, which I do not, to the end of 26, you'd see a number of those African countries that are still outstanding coming online as well. So we've seen that commitment from countries, including Pakistan this year, planning to introduce later this year. Mongolia is a recent introduction, Tunisia. So we're just seeing around the world the adoption and the introduction of the HPV vaccine. And that's starting to reflect in the data. So this is WHO data that they release every year in July. And so right now we're still working with data from the end of 2023. But you can see, especially looking at that first dose coverage of the HPV vaccine among girls in those Gavi countries, that line is starting to go up. And we're anticipating that line to continue to go up in 2024, 2025, and beyond. And part of the reason that I'm emphasizing on the first dose coverage is that one of the other facilitators of the HPV vaccine uptake has been the adoption of a single dose schedule. So we now have very good evidence that many countries have adopted to say that with just one dose of the HPV vaccine, we can achieve lifetime immunity from HPV. But even as we look farther ahead into the future and looking at our own forecasts, we see that we will both achieve the 86 million goal and perhaps a bit early, but that the momentum of the programs that are introducing the vaccine now will continue to reach more and more girls, millions and millions of more girls every year. So as we think about the number of girls that are reached during the introduction, that's one thing. But realizing that every year after year, we have to make sure that we are reaching girls that have been identified as eligible for vaccination time after time. And one of the challenges of this program is that the girls who are vaccinated with the HPV vaccine tend to be 9 or 10 years old. And those girls are not generally going to the health facility. They've already completed their other vaccinations. They haven't started accessing services they may start using when they're women. And so in order to reach those girls, we have to build systems that reach them every year and make sure that they're aware of the vaccine and that the vaccine is brought to where those girls are. And so that is really, as much as the effort now is resulting in this scale up, in the long term, it's really going to be about those programs that reach girls every year as they age into eligibility. So some of the key trends for HPV vaccine programs, looking ahead, many of the introductions in the large countries around the world will have been completed, and many of the countries that are yet to introduce the vaccine will be those that are facing situations of fragility or conflict. And so we need to think carefully about how do we introduce the vaccine in those settings in a strategic way so that we can reach girls in those settings. Another key trend is around the question of integration. So right now, in many countries, they are looking at ways to integrate HPV vaccine delivery with other services for adolescents. And so incorporating that learning into future programs is a way both to sustain that delivery of the vaccine, reduce the costs, and also to improve the quality of services that those adolescents receive. And then the second part of integration is looking at vaccination and other aspects of cervical cancer elimination, especially screening for adult women. So thinking about a girl who is eligible for the vaccine, are there adult women in her life that would be eligible for screening that we could communicate to them at the same time and bring them together for services? And then lastly, this issue of sustainability. One of the constraints that we've had in the program over time has been supply of the vaccine. Those days are over. We are now in a situation where we have sufficient supply, and looking ahead, we'll have an increasing variety of vaccines available in the market and prices coming down. So that piece of sustainability will be improving. But as I said before, one of the most important things is going to be that we have these established vaccination programs that are focused on sustaining delivery over time and achieving that generational immunity. So thank you very much for being part of it, and I'll pass it to the next speaker.
Thank you so much, Emily. It's really exciting to hear such a, promising outlook and promising progress that we've had to date, and particularly for highlighting those points around integration and sustainability to be really important pieces. I'd now like to hand over to Hamza Zakira, who's going to talk to us about the role of and value and engagement of civil society organization in Gavi's work. Now, Hamza is the Senior Manager, Strategic Partnerships and CSO Liaison at Gavi, and he leads on strategic partnerships and engagement with civil society organizations, including oversight of the Gavi CSO constituency. Hamza, over to you.
Thank you so much. I really would like to mark this moment by saying how much I appreciate the work that UICC is doing to bring those two communities together. I think that we are, the cancer prevention community, the CSOs that are working in the immunization. When we're looking at HPV, we really two sides of the same coin. So it's great that we do this. My role here is really to I understand that from outside is a little bit complicated to understand what is the Gavi CSO engagement model. So I will just try to simplify it for you. And then after that, I will pass it on to my colleague Marumbo, who is going to talk to you a little bit more granularly on the sort of resources available, the envelopes, the way that we can really engage the CSO. So let me share my screen. I'm trying to Share my screen. I'm having a little. Okay, I'm usually on Teams, so okay, and okay. Sorry. Okay. So I'm going to talk to you a little bit about the Gavi CSO constituency, starting with the two highest ranking officials of what we call the constituency. They are our two board representatives, so representative. The main one is Dr. Budzai. She works for Village Reach, and the alternate is Dr. One. He works for World Vision. Throughout the slides, at some point, I'm going to show you how the sort of the organigram looks like, but it's important to put a face to those names that you probably would have heard by now. Let's start with the definition. Gavi has a very, very sort of broad definition of CSOs, consider civil societies to encompass the full range of formal and informal, non-governmental and not-for-profit organizations that represents the interest, expertise, and values of communities. It includes CBOs, FBOs, INGOs, civil society networks, local professional association, non-for-profit. And it's not about global versus local. It's really an ecosystem that has everything. We are working in some cases at the very subnational level, but we also have regional CSOs or global CSOs. There is a different purpose for different formats. And we're really trying to have this broad definition so we can be sort of tailor-made for various various contexts. Okay, this is a live number. Right now, registered to our CSO constituency, we have around 845. This is a quick snapshot. As you can see, there's a strong concentration in Africa. We are trying to expand a bit more in Asia Pacific, but we also put some of the European and the North African and North American CSOs, because it's not just about the CSOs that are advancing Gavi's mandate with delivery, advocacy, and things like that, but it's also the CSOs from the donor countries that have a role, for example, when there is replenishment or things like that. So we're trying to have a really diverse ecosystem. The constituency was funded to ensure there is meaningful participation to Gavi by the CSOs. Some of you in this call, I'm thinking about my colleague Huma that is going to speak later on. When I exchanged with her, she was there even before me, and she will have seen all of the various iterations of the model. But I think that the important thing to note here is that the things that have not moved is this continuous need to strengthen collaboration, a stronger partnership with CSOs, amplifying community voices and making sure that no one is left behind. The format that we end up having matters less as long as we have those objectives that we're trying to achieve. The civil society constituency has been around for 10 years. And I will go into some of the models. But again, the goal has been to really engage CSOs around the globe, to get meaningful engagement, to make sure that they are independent, that they hold us accountable as well. This is a very important part. But this model of governance that I'm about to show you it's the sort of the governance for the CSO constituency, and also that model needs to be held accountable by the constituency itself. At some point in the presentation, I will show you the website and the way that you can register to be part of the constituency. And yes, CSOs are pivotal partners in Gavi's immunization efforts. However, I want to to pause a little bit here. And yes, CSOs are a fundamental partner, but they are more than just a partner. They are, for us, also a core component of what we consider country systems, because the Gavi model, when it's all said and done, when the country graduates, there needs to be sustainability, and the only way you can have sustainability is if the country stakeholders, the national stakeholders, are part of the tapestry. Obviously, it varies from country to country. So yeah, this element of being a country system is important. Now, this is the most recent sort of model that we had. As you can see at the bottom, you have the wider CSO constituency. I think that this is important. And between the bottom and the top describes like the governance. We have a host. And the host, it's a third party host, so it's AMREF. And what were they hosting until recently? Then I'm going to tell you about a little bit of a change. They were hosting the governance. The core governance really is the board, the alternate board. You can see at the top, and there's the two people that I've told you about. They are supported by a special advisor, and then you have PPC rep, and PPC, it's basically the technical papers that feed some of those board decisions. Until recently, that governance subpart that I showed at the top was part of a group of 18 members called the steering committee. And so it would be the board, the alternate board, the PPC rep, plus other members of the steering committee that are not direct part of our board, but that have been decided to serve through AMREF as a bridge to leverage the voices of the wider CSO constituency. Why am I showing you this? It's because this has changed. This year, we are in the process of starting a full redesign work stream. And one of the first things that has changed is that the steering committee, that sort of bridge, right now we're going back to the drawing board to see how we can improve that bit. So until then, and until the end of the year, the host AMREF is no longer supporting the steering committee, but now is supporting directly the top part of the governance, which is the board bit, and they also coordinate the wider CSO constituency. This is why you see at the top there is an arrow that shows what part is the governance, and then an important thing is that the moment you're part of the governance, you're also part of the constituency. That's just the model. This is why there is the big arrow next to it. It has been a challenge to try to put it into a couple of slides, but it's just to give you the gist of it, and also to let you know, most importantly, and some of you will have received the communication that the steering committee is suspended as we go back to the drawing board, but that a design team is going to start. There's going to be more communications, and there's going to be consultations about that. And it's not just about consulting the CSOs that we know. This is why I'm happy that we have new faces, and I'm hoping that everybody can join the constituency. This is the website to join the constituency. When you go on it, there is a form. And I'm about to transition to my colleague Marumbo, but just to give you a last transition point. So we have this constituency, we've had the steering committee, but the sort of activities that we gave you the definition of CSOs, but the sort of activities that the CSOs do predominantly has been around demand generation, service delivery, going places where sometimes the governments cannot go. But there's also an element of advocacy, and I just want to quickly pause on this advocacy because one thing is independent advocacy to hold Gavi and the governments accountable, and the other part is the advocacy that is programmatic advocacy that is part of the wider vision that we have at the country level. And I'm going to pass it on to my colleague Marumbo, that she's going to explain this in very important thing, which is that in 2021, the board decided that 10% of the sort of envelope that goes to the countries has to be safeguarded at minimum for CSOs. This means that there is a full mechanisms of how we granting CSOs. And yes, without further ado, I'm going to pass it on to Marumbo, and I'm going to continue with those slides as she speaks. Marumbo, the floor is yours.
Thank you, Hamza. That's great. And whilst Marumbo is coming off mute, I'll just let you know that Marumbo is the head of the program support team of the country delivery department at Gavi, providing oversight and leadership to this mechanism, the end-to-end grants management, partnership engagement, knowledge management, and process improvement. And Marumbo, over to you.
No, thank you so much. And I would want to apologize where I'm sitting might be noisy because I'm out of the office and you hear background noise. So just apologies for that. And thanks for the introduction. So really building up from Emily and Hamza here. I was trying to ask for some quietness, but apologies, I'll try to speak over the voice. So building from what Hamza and Emily have shared, Gavi's commitment to CSOs engagement has strengthened, and it is one of the key areas that we want to emphasize in this call in terms of bringing CSOs stronger into the ecosystem, but also voices to be heard. Hamza shared about the 10% that has been allocated based on the board decision in 2021. I also want to say that the board has further decided to continue that for our 6.0 strategic period, which is starting 2026 onwards, to still have a guardrail to ring fence resources that are going to be going towards CSOs using what Hamza has shared as the definition of who is part of that ecosystem. So for me, this is an important point for us here, whereby the emphasis of knowing that CSOs are a critical member of this ecosystem and the value that they bring is really being realized. So I just wanted to start by emphasizing that in our 5.20 strategic period, that was the starting. Now in our 6.0, that remains the same, where we have got a ring fence of resources to support the work of CSOs. What this means for me, mostly as we share here and looking at the work that you're doing on HPV and on all the support that is coming through, is that there is now going to be a lot of focus on the results. The resources are out there. What results are we bringing? How are we bringing them? Is a discussion that will follow. I'm going to come here because I think Hamza has spoke about advocacy, demand and service delivery. The work that this group here is doing a lot within the different areas of work, inclusive of the HPV work, is to ensure that we have the demand for the vaccines. We also go to the last mile where we cannot reach. And when I speak about girls, myself coming from a country where also I know the challenges we have, most girls are in school or are out of schools, and we want them to have this vaccine. Then we have got our own cultural and social norms that are always a barrier. I'm just bringing the multiple barriers. And who are the people that these communities, as well as the girls who trust? It is always girls, I'm just giving it, but we know it's girls and boys, but it is always going to be CSOs. They trust them, they live with them. These are the ecosystem. And for Gavi, we really want to strengthen that this last mile, this engagement of both demand service delivery as well as advocacy already mentioned is achieved. So the work that we do, the funding that we have, we categorize it in these three areas: global, regional, in country, to help CSOs to be able to achieve what they can do in this. And I think Emily already mapped it out. I just want to emphasize that within this, we have also seen 17 HPV technical service providers at a global level, to just emphasize how we are working in the ecosystem. To the next slide, Hamza. The 10% that we are talking about, it is a total cash grants that Gavi supports countries with. We have realized that for us to make sure that CSOs are able to access these resources, there are multiple pathways. Otherwise, it will take longer. And it's feedback that Gavi always gets, that we take long to contract, we take long to get money into the hands of CSOs. So we are looking at improving and emphasizing how best can we ensure that we get money into the hands of CSOs. So we have got multiple channels. We have the channel where you can get contracted directly with Gavi, and some of our partners here have had those contracts. We have a channel whereby we can also have the PMU, the government PMUs. Some of you out there in countries are being contracted through that. We also have the Alliance, UNICEF, being the channel where we go through UNICEF contracts CSOs, and we have introduced the fund manager mechanism. This one has been introduced for the past, now we are in the second year of implementation. The fund manager is an outsourced one. We have Manion Daniels. This is just to ensure that we can make at least our processes as fast as possible. Once we know what is the need, the processes have been achieved, the full portfolio planning has been done at country level, and at country level will do full portfolio planning for any of the different areas we do. Let's ensure that the resources are able to reach the civil society organization. The fund manager mechanism, we are really pushing it hard so that we can try to see which of these models allows us to go out faster, efficiently, etc. So we have all this to respond to the 10% that is available for supporting all the different countries to access resources in Gavi as civil society organization who are doing multiple things, in service, in demand, in service delivery, demand, as well as in advocacy. If we go to the next slide, just to quickly highlight, I didn't want to repeat what my colleagues have shared, but it was just to be saying, what have we done? Hamza talked about the hosting arrangement. We also have to look at what are some of the operational mechanisms that we want to improve on. So for us, we have looked at how to make sure that we are enhancing our systems, our processes and structures to support civil society organization. I've spoken about the financing mechanism. As much as the resources are there, there's been challenges. We have received feedback of how difficult it can be to access resources. We still are working. We are trying to do this. Of course, we have competitive processes at global, regional level that we go through to make sure we have good, diversified partners that we can work with. And Emily, as she shared, we have got global organizations that are working with us. All of this is to ensure that we have a good engagement with civil society organization. The funding goes to those that can deliver the work, but also demonstrate the results. I want to emphasize here how Gavi is working now. We have what we call the accelerator grant. These are grants that we are focusing on those sub-national, local in Pakistan, in the sub-national, in the sub-provinces, where we can have local organization accessing those funding that are within a minimum, but those are civil societies that needs some help as they build their own strength in the ecosystem, but communities trust them. They are out there, but sometimes they're not visible. We have that accelerator grant that we are working with. We have the impact grants that also we are doing within this fund manager mechanism, targeting all the others that are also working at the national, sometimes at the multi-country level, etc. So Gavi is trying to explore as much as we can multiple mechanisms of making funds available to civil societies to be able to continue playing the different roles that we have at subnational, national, multi-country, across the globe to ensure that we can drive these programs. So I will stop here, Hamza. I don't know if I need to proceed, but I will stop here, and apologies for the background noise.
Thank you so much, Marimbo. And there wasn't too much background noise at all. You spoke very clearly. So thank you so much for that overview, and really to you all for highlighting the role and value of civil society organizations in increasing uptake and access to HPV vaccination, and really highlighting how CSOs can be engaged and be supported. Now, I'd really like to move to a short panel where we have two speakers who are going to bring different country perspectives and showcase some of their involvement around civil society engagement in their respective contexts. So first of all, I'd like to invite Dr. Zainab Shinkafi Bagudu, who is a distinguished pediatrician, advocate, and global health leader with a really profound commitment to women's health and cancer care. She's really pioneered Nigerian healthcare, establishing the Medicaid Radio Diagnostics and Clinics, the first comprehensive diagnostic center in Abuja, addressing a critical gap in medical services. She also founded the Medicaid Cancer Foundation, driving awareness, prevention, and improving access to treatment. The foundation has raised over $2 million for addressing gaps in cancer care. And as the former First Lady of Kebbi State, Dr. Bagudu leveraged her position to spearhead transformative healthcare initiatives, including the development of a comprehensive cancer control plan, and important for this webinar, specifically the expansion of HPV vaccination for girls. She's been on the board of the UICC Board of Directors since 2018 and became the first African president-elect of UICC in 2024. And her advocacy really does extend globally through her various roles. Welcome, Zainab.
Hi, Kirsty. Hi, everyone. It's a pleasure to be here.
I'd also like to invite Huma Kawa, the strategic advisor for the Gavi CSO mechanism from Mannion Daniels. So Huma is an advocate for civil society engagement and strengthening. She's been working with Pakistan's expanded program on immunization since 2007, coordinating between government and CSOs on immunization and health in Pakistan. She has 30 years of well-rounded media experience working as an independent journalist and consultant, contributing articles and features to newspapers and periodicals with a special emphasis on women and children. And thank you to both for joining us today. So first of all, and Zainab, I'll start with you. It'd be great if you could provide just a brief overview of HPV vaccine introduction in Nigeria. What is the context in Nigeria? When was it introduced? And any initial successes or challenges?
Okay, thank you. I'm sure many people saw the slide that was presented earlier. Nigeria as a country is quite a large, one of the large African countries with a population of around 230 million. And introduced the HPV vaccine to the routine immunization, not routine, but available by government to girls aged between 9 and 14, with Gavi support as well as other partners, government, UNICEF, WHO. It was introduced in 2023. So that was the first rollout of the vaccine, and it was quite successful as an outreach. In the initial stage was the initial rollout. The first phase was 7 million girls, and the second one took us to about 12 million. And to date, there's about just over 13 million girls vaccinated. It didn't come easily. there was a lot of work that went on behind the scenes to advocate, working with partners like UICC, like a lot of in the global civil societies, as well as from within. We had a lot of pressure from in-country civil society organizations. I worked with the First Ladies Against Cancer. This was also one of the platforms that was used to advocate for the inclusion of Nigeria into the vaccine HPV eligible states. So barriers, yes, they exist. And the greatest of all that I will mention straight away is misinformation. There's a lot of misinformation around HPV vaccine, mainly because it targets girls. So there's been sexualizing of the vaccine. And also the fact that, you know, the age group of girls that we're targeting, that makes it prone to lots of misinformation, which I won't repeat here, but I know that we all know what we mean. So those were the main barriers. I'm sure those that are working in the technical end of it, the ministry and so on, as well as even our partners, Gavi, will tell us about the funding, logistic problems, the systems problems that we engage, especially when it comes to the vaccine storage and getting it into the country and to the various primary healthcare centers. I must say, though, that before the introduction, one of the things that I didn't quite understand when we were all just pushing for it was that Gavi insisted on having the health system strengthening in place in the country first. And that helped us to really strengthen the vaccine delivery pathway. I believe the third round was just launched a couple of days ago, and that saw many of the states being included in a systemic review of their logistic pathway, right from the delivery of the vaccine, the whole cold chain. A lot, I don't have the number, but a huge amount of capacity building sessions went on, as well as provision of solar-powered refrigerators for storing, a good training on how to store the vaccines. And for the first time, we saw that this was working very well. So by the time the HPV vaccine came in, it wasn't just affecting HPV, but also the other vaccination statistics. So those were the kind of issues that we had, but with proper planning, we have been able to have reasonable success. I hope I didn't say too long.
No, not at all. Thank you, Zainab, and thank you just for providing that overview of some of the barriers, and also some of the pieces that Gavi has emphasized. For example, the health system strengthening piece in supporting the introduction. That's really valuable. Thank you. Now, Huma, over to you. It'd be great if you could provide likewise a context of HPV vaccination in Pakistan.
Well, first of all, I want to really thank you, UICC, for this opportunity and for taking up a subject, the potential of CSOs, which is very close to my heart. And don't mind, I become very emotional on this. I joined, I actually led the Gavi CSO pilot project in 2007, and that's how I came very close to EPI. And at that time, EPI only had 6 vaccines. Then the EPI added Hep vaccine, hepatitis, and Hep, and then it became a combo of pentavalent with Gavi support. After that, in 2012, PCV10 came to the country, which was a new and expensive vaccine. And it was the program got immense credit for bringing in such an expensive vaccine in such short time to the children of Pakistan. This was followed by rotavirus, IPV. And then in 2019, Pakistan became the first country to introduce typhoid conjugate vaccine. That was a big landmark in Pakistan's vaccine history because all eyes of the world were on Pakistan, and the radar was there. And now into 2025 is the year that marks the introduction of a vaccine that is for cervical cancer, as the country is set to roll out HPV. And I think loads and loads of work needs to be done, but we are getting prepared for it along with civil society organization. The introduction will begin with a one-time multi-age cohort planned for September this year. In the first phase, the campaign will be conducted in Punjab, Sindh, Islamabad, and AJK, and targeting girls from 9 years to 14 years. And this will be followed by the campaign which will be actually introducing and integrating into routine immunization, and the CSOs will be working for HPV integration because of the 9-year-old age cohort will be actually eligible for the routine immunization vaccine.
Thank you so much, Emma. It's really exciting to hear about that upcoming introduction or campaign that's coming this year. So thank you. It's Zainab, just to hand over back to you, you've mentioned obviously the importance of advocacy, and as the CEO of a very strong civil society organization in Nigeria, it'd be great if you could just provide a few more examples or expand on the CSO engagement in securing introduction of HPV vaccination, and particularly in any of the Gavi mechanisms.
Well, yes, CSOs play an important role, as we've heard, and one of the ways in which we were able to work was that Gavi, between Gavi and I think it was UNICEF, and as well as the providers of the vaccine, they identified an umbrella body that was mandated with the task of disseminating the information, sharing knowledge, and building capacity of civil society members. So organizations were picked from across the country and brought together, they zoned it, and they were brought together at different locations on how to introduce, this was pre-vaccine introduction, on how to introduce the vaccine, the details of the vaccine that we would be getting, as well as the key stakeholders in the community to engage. So that came directly, indirectly through Gavi, but they didn't just throw the vaccine at us. There was a lot of work that was done with without that laying the ground that the CSOs did, it would have been a huge disaster. We did have, of course, like I mentioned, some very high profile misinformation going around, but because of the work that had been done, we were able to counter it. And I must also say that the UICC, as well as WHO, do have regular webinars that sensitizes CSOs and community members on the importance of HPV and so on. I want to say a word about community gatekeepers. Our traditional and religious rulers are a set of people that are very, very key in the African context and especially in the Nigerian context. So they were engaged. They have a council that the Ministry of Health and the Primary Healthcare Development Agency, which is the agency that is charged with the responsibility of vaccine introduction, they engage them and they have regular council meetings, and they are empowered to share with their constituents about the details of whether it's vaccine. It started since polio, when we had the polio issues, and it has been very effective in reaching out to the members of the community. And I know that they regularly meet with the Gavi representatives in Nigeria, or when they are coming on country missions, they engage with that unit a lot. The Governors Forum is another one that is very key. Nigeria is divided into 36 states. Each state has a state governor, and they work with the governors, because without the governor's support to have each state roll out the vaccine can be sometimes problematic. And that is where also advocacy comes in. Working with the governors, they need funding, counterpart fundings to be released at different times, at different stages. If one state falls behind, then it tends to affect the others and the whole rollout process. So sometimes it's good to work with civil society members, advocates like myself, like the traditional rulers, that are able to press those buttons to get the required funding released. Gavi's done the bulk of the work, the huge spending and the vaccines, but then we still have to foil the smaller cars that are going, or even the motorcycles, we're not talking cars here. We're talking boats that are going to get hard to reach areas, salaries that have to be paid to the community health extension workers. So we need everybody. And it's a multi-stakeholder operation. And I think we did that reasonably well in the last 2 rounds. What I'm not so, one of the issues that I still see is the routinization of it. It's still not effectively routinized, but I believe that with time, we'll get that right as well.
Thank you so much, Zainab, and some really key points to come for people to keep in mind, and that engagement pre-introduction of the civil society organization seemed like such a valuable piece. The engagement of the gatekeepers and these key four at different levels of stakeholder engagement. And it certainly sounds like Nigeria's managed to vaccinate so many girls with this recent effort in the last 2 years. So that's really fantastic. And Humar, I'd like to ask you a similar question, really. If you could just expand on how civil society organizations have been engaged in securing or in planning for and preparing for the upcoming introduction, and the role that they've played. What does that look like concretely?
Well, as Murambo explained, Mannion and Daniels, through Mannion and Daniels, Pakistan, under the 10% that is allocated for the civil society organization, has contracted about 18 organizations that are working both under impact as well as accelerator grants also. Out of those 18 organizations, 5 organizations have been selected to work particularly, especially on HPV. So they will be supporting the government for HPV introduction, while the actual on-routine immunization will also be ongoing, supporting their respective areas and provinces and federating areas for HPV introduction. We believe now that, first of all, it's very good to learn the lessons from Nigeria as well, because, Pakistan has so many similarities with Nigeria. We are still a polio endemic country, and all the credit goes to Nigeria for eradicating polio. And now we are just left with 2 countries, which is Pakistan and Afghanistan. But we feel that the experiences of Nigeria in HPV will also be very helpful, especially we also have a very dynamic and a very robust civil society organizations set up. But for Pakistan, I believe that, civil societies can play a vital role in, as already explained, raising awareness and improving access and fostering acceptance of HPV. The engagement will be key, actually, to the success of both the campaign as well as their inclusion in routine immunization. Because I personally believe, and we all know, that one competitive advantage of civil society organization is their reach, their presence, and their trust in the community. Now, no amount of mass media organizations or the media campaigns can do or affect the community that the way the civil societies can do. When the person has this bilateral communication with the people who are rigid in vaccination and explains to them, and what the buy-in is actually is above all any kind of media campaign. So the civil societies, can address cultural barriers by combating misinformation surrounding vaccination. Our target age group, as Nigeria also said, is 9 to 14 years old, which is a very, very sensitive age group. So civil societies will have the capacity to address their barriers that affect vaccine uptake in Pakistan, such as, patriarchal norms that prioritize boys over girls. So they will be, advocating for equitable access to vaccines for all children, and this will be their vital goal. The other very important thing CSOs will be doing in Pakistan is, reaching out to the out-of-school girls. From the entire 18 million target age group that we have for the whole country, more than 45% are out-of-school girls. So this cohort, this age group can only be reached by civil society organizations who will be working in the community, who will be working with the community people, who will be advocating with religious leaders, Friday sermons, mosque announcements, influencers, and they have access to hard to reach areas. They work in urban slums. So all kind of comparative advantages of this kind of a cohort will be for civil society to address.
Thank you so much, Humar. It was great to hear very concretely, actually, how 18 organizations have benefited from the funding that has been made available via Gavi in Pakistan, and that number of organizations are involved, and also just that reference you made to the percentage of out-of-school girls. I think Emily touched upon that in her presentation at the beginning, this importance of civil society for really increasing the reach of the vaccine and targeting these girls who are not necessarily in the school system. I have many more questions I can ask you. I'm very conscious of time, and I want to make sure that there's a little bit of time for some questions. Just a quick question from the chat for Huma. Is the Pakistani Red Crescent involved in preparing or supporting HPV vaccination in any way in Pakistan?
Not yet for HPV, because we are still actually, in the process of coordinating with the partners. There are many expanded partners of Gavi, co-partners of Gavi. They're supporting demand generation and service delivery for HPV, and CSOs are just one of them. So Red Crescent is already, working on routine immunization, and they will be in touch with us when we are coordinating, because all the partners come together to support each other.
Great, thank you, Huma. And Zainab, there was a question which you've touched upon in some ways in your answers so far, but there's a question in the chat around just how Nigeria has managed to vaccinate such a huge cohort of girls in the space of the last 2 years.
I think the answer is very simple. Nigeria has a huge number of girls. We haven't covered half of what we need to cover. So whilst one section are kicking against it, we still have a whole number, a huge numbers that are waiting to be vaccinated. Our experience till date from a pilot study that we carried out in 2018 is that we're still getting calls asking us to come back to the states, to the area of the states from the traditional ruler to vaccinate the rest of the girls. We did it as a pilot, and we weren't able to complete, obviously, the number of girls, but they want you to really come and do it. So it's a simple answer there. And once you have all those issues in place and address all the points, then we find that we're able to. The problem will come when we reach the end of the, or high end of the vaccination trend, and those few, how are we going to convince them to get vaccinated?
Thank you, Zainab. And I'd just like to end, Emily, with a question for you that's come up in the chat. I know it's a question that comes up a lot from the community and one I've heard you answer before. So the question is where Gavi's position around vaccinating and delivering HPV vaccines for boys. The question states that there is, it's being rolled out in some of the global north countries, and there are certain countries such as Cameroon that has a gender neutral HPV policy. So it'd just be great to get your thoughts on that before we finish.
Yes, so this does come up quite a lot. And I'd really also encourage CSOs to think about equity in terms of older girls who may not be reached now, but could also benefit from the HPV vaccine. It's not just about the girls and the boys, it's also about those other girls and women. For Gavi, we follow the World Health Organization's guidance, and what they have said is that the highest priority group that you absolutely must get first is girls aged 9 to 14. And the reason for that is the vaccine has been shown to be the most effective at preventing cancer if you reach girls at that age. And we're focused on cervical cancer, which only girls can get, because it's the most common HPV-associated cancer by far. So it's a matter of prioritization. It's not to say that boys aren't important. It's not to say that older girls or women would not also benefit from the vaccine, but it's just about starting where the priority is. If I could steal another 30 seconds,
Yes,
there was one other question in the chat about what do we know about what it takes to sustain HPV vaccination programs. And I just want to say, the HPV vaccine has been introduced in over 140 countries around the world at a range of income levels, many different cultural contexts, economic contexts. And what we've seen is that the key is that the country chooses a set of delivery strategies that reach the target population where they are. And in many countries, that's in schools. And so partnering with Ministry of Education to have an effective vaccination program that reaches girls in schools, but also doesn't leave behind girls that are out of school, and that has effective strategies for reaching those girls out of school. Now, you have to have that strategy and you have to finance it. And so it's really in the hands of government to make sure that each year there is funding available to deliver the HPV vaccines. As for Gavi, we are committed to making sure the vaccines are available in partnership with government, so the vaccines will be there. But we're asking you as advocates to work with your governments on those delivery strategies and those annual budgets that mean that the vaccines can reach the girls where they are.
Thank you, Emily. And that is a great place to finish with that reference in the importance of budget advocacy and health financing. And UIC has quite a number of resources also to support civil society organizations in advocacy efforts and in budget advocacy specifically. So it really just leaves me to thank all the speakers for the information that you've shared and for your time. It's very much appreciated. I hope those joining have found this useful. Please don't hesitate to get in touch if you have any questions, and we'll send round the recording of this virtual dialogue, as well as some other resources and materials that may be of interest to you in an email shortly that will come to you in the next day or so. But thank you so much, everyone, for joining. And yeah, that leaves me to say goodbye for now. Thank you.